So this is a mobilization for the first metatarsal and the first cuneiform joint right here. What can happen sometimes, just got these bones organized in the right spot. What can happen sometimes is this first metatarsal bone can end up in a position like this. This is the left foot. So it's as if the first metatarsal bone has drifted across to the midline of the body. We call this a first metatarsal adduction. Adduction meaning moving towards midline, adding to midline. But what this can do is create compression in this joint here. You can see when the bone travels across, it closes the space right here. And then it can cause some trouble for when we're walking or weight bearing and articulating through the foot. That compression impedes movement and doesn't feel very comfortable. It can feel painful. So what we're going to do is a mobilization to help to open up that joint. So essentially what you're going to be doing in this first one, it's a manual technique that you can do on yourself. You're going to be with one hand holding the tarsal bones of the foot. So the midfoot you're going to hold. The other hand, you're going to traction. So creating space by pulling down. And then you're going to try to gap open that joint by abducting the first metatarsal and create space there. So you can do this sitting down. It can be awkward, but it's effective if you can get it. So what you're going to do with if this is my right foot that I'm mobilizing, I'm going to take my left hand and I'm going to grab on with my thumb over top of the arch of the foot, the highest point of the arch. I'm going to grab on like that firmly to stabilize. My other hand, I'm going to grab on to my first metatarsal. So you can see I have a little bit of space between my two hands. The joint we're trying to mobilize is right in this area. So I'm holding on. With my right hand, I'm going to traction away from my hand on my midfoot. And then I'm going to open the joint by doing this kind of motion. So if I exaggerate with my hands, I'm pulling this way, like I'm opening a jar, turning clockwise with my hand. And that's going to gap the joint. So I'm going to traction and then I'm going to open. And this would be easier to see with a top-down camera. But imagine that I'm taking my hand and I'm going like this. My bottom hand staying fixed, stabilizing the joint below, and then I'm mobilizing above. So traction and gap. This should feel like you get a little bit of stretch through this area of the foot here. Do that a few times until it feels like you're getting a little bit more pliability in your foot. You should be able to see in your hands that you're actually creating this kind of movement. But we want to integrate this now into a weight-bearing context. So one way to start doing this, it's certainly not the only way, but it's a good way to start, is to do that in a kneeling position. So my right foot, again, the one I just mobilized with my hands. Now my heel's on the ground, so I don't need to stabilize it with my hand. I'm going to put my right hand under my foot. So I'm not under the ball of the foot because I want to be able to weight bear into that a little bit. Well, I'm a little bit with my pinky finger under the ball of my foot. And we're trying to create that same sort of opening of the foot. So now I'm taking my hand and I'm actually kind of turning my sole of my foot towards the ceiling and also doing that clockwise rotation. So I'm really opening this area of my foot. You can even turn your foot slightly out like that. So not pointing straight forward, but slightly out. And what you're going to do is bend your knee and lunge forward a little bit and twist your hips. So you can see as I do this, I'm creating some gapping on the inner side of my foot because I'm holding my foot with my hand. But as I'm bending my knee and twisting my hips, I'm getting this space in my foot to start to decompress. So I'm really actively using my right arm here. And yeah, I'm starting to feel some stretch under my arch. If it's a little painful on your hand to do that, because you kind of have to stand on your hand, you can take a sock roll it up a few times, and you can put it under there like that, just to elevate your foot. It's not as effective because it's not quite as specific, but just doing that, and then you're really twisting your hips away from your front foot to create this spiraling down into your arch of your foot that opens up the joints there. So give that a go and see if that helps to get a little bit more movement and decompression in that first metatarsal, first cuneiform joint.